Hello, CoronaWatch viewers. Today we will be interviewing Loudoun County's Health Director, Dr. David Goodfriend. Dr. Goodfriend, would you like to introduce yourself?
Hi, thank you for inviting me. I'm Dr. David Goodfriend, Director of the Loudoun County Health Department.
Awesome. So, for our viewers, what exactly do you do as the Health Director for Loudoun?
So in Virginia, every county and city is required to have a local health department. We all do a number of different functions to serve our jurisdictions. One of them is provide core public health services for some of the county's most indigent residents who can't get care elsewhere, and that could be immunizations, dental services, family planning and maternity care. We do restaurant inspections to make sure that the restaurants and related facilities are safe places for folks to eat. Similarly with the swimming pools of disease, like again, what we're seeing now with COVID. And so our emergency preparedness efforts are very focused on how we would mobilize people to get vaccines to them as quickly as possible, while our communicable disease folks are focused on how do we keep people safe now before the vaccine's available.
Awesome. Thank you for your service. So, as you know, we at CoronaWatch, we've been tracking the numbers actually since April of the pandemic, and what we've noticed is it's a lot of fluctuation between numbers, but sometimes between certain months you can clearly see that these were spike months, right? And we noticed that this is one of those times, and we think that's because of holidays and stuff. So how is Loudoun reacting to those?
Yeah, so there are two main reasons driving our increased numbers now. One is, as you said, holidays, people getting together. It's a transmissible virus, so it's easy to spread. The other piece is the virus likes cold weather. Just like most other coronaviruses, which cause the common cold, you're much more likely to get it in December, January, February than you are in the summer. So now that we're entering into December, the virus is easier to transmit. And that's a good part of why we're seeing our numbers increase now. And so those practices that people were engaging in before of not separating by 6 feet, not wearing masks, going to parties at each other's house that they could get away with in August, you just can't get away with now.
So, there's been a lot of discussion across the country about mask mandates and, masks in general. Do you believe that there could be a big benefit if there's a mask mandate across the country or even across Loudoun?
What the science tells us is that masks usage is one of the most important things people can do. And fortunately, we have most folks now in Loudoun County that wear masks when they're within 6 feet of individuals. And that's important, and it's helped keeping our numbers down. It did a great job before when, as you mentioned, our numbers were going up, and then all of a sudden we did interventions and started bringing them down again. But that's only part of it. The other piece is the social distancing. The Halloween parties, which hopefully none of you went to, the big Thanksgiving dinners, hopefully you didn't go to, and we have holidays coming up as well in December.
All right, so I have the next question. So, assuming all Loudoun County residents follow social distancing / mask mandates and rules, how fast do you think we can return to a normalcy? And when we mean normalcy, we mean like fully normal, like pre-COVID.
Yeah. So what taking these mitigation steps now will help us do is potentially allow kids to come back to school, allow us to have somewhat normal life. We're not going to go back to pre-COVID days until enough folks are vaccinated so that we're not having person-to-person transmission. So likely throughout the winter, we're going to have COVID disease, even with vaccinations starting, because it's transmitted so easily in the winter. But once we get into March and April, if enough folks get vaccinated and people are doing the right things, we may see those numbers go down. But still, we'd be wearing masks, keeping distancing, probably into the summer.
So then, how long do you think like it's gonna take to go fully back to normal? Like, if like a lot of months, maybe a few years.
Well, I think we might be able to do that this summer because the virus doesn't like warm weather as much as cold weather, which is in part why we saw our numbers down in the summer. And if people take advantage of the vaccine, there are fewer places where the virus can go and spread. So if we do our jobs right, then maybe the last quarter of the school year could be a normal time, but probably we're talking the summer, and then start off next year with a normal school year.
Do you think like the new White House administration coming in? Do you think they'll be able to help a lot with like COVID and getting it, I guess, like behind us?
Well, my hope is, I mean, the good part is we have vaccine coming along. That's going to play a very important role. But the vaccine is not going to make a difference in the short run. It's going to take months to get folks vaccinated. And then for almost all of the vaccines, you need a second dose 3 to 4 weeks later. So then you're adding another month after when you get even your first dose of vaccine. So that's probably not going to help folks for another 3 to 4 months at least. It's the other piece of mask use, social distancing, not going to New Year's Eve parties, and doing all of our parts that's going to really help in the meantime. And having a consistent message at all levels is really helpful to that end. So the more people we have doing that, the better we'll be.
So you said that you hoped with the incoming administration that you hope to see like better numbers and stuff. Do you think that there will be specific policies that they will put in that will make the case numbers drop?
Well, probably it's unfortunate, but we would expect the numbers to continue going up at least through January, if not through February, just because the virus likes this weather. And so,
okay.
And so the real impact will be the vaccine in the winter. Now we hope that more folks will follow those mitigation steps that we know have been working. But the way our government works, it's very unlikely that other than having that political leadership to reinforce the mitigating factors, that there's much that the federal government can do to require it. In Virginia, we're fortunate that we have had some mask requirements in place. We've had social distancing and social gathering restrictions in place. And that's done a lot to keep our numbers down. A lot of our neighboring states are doing worse right now than Virginia is.
Okay, that's good to hear. So I do have a little bit of a technical question. So there are some people that are stuck with elders in the house, and if they do have COVID, right? What are they expected to do? Are they expected to stay at home and self-quarantine, or is there like a system in place?
Yeah, so that's really important that if someone has COVID, that they isolate, and the two terms we hear a lot is isolation and quarantine. Isolation refers to people who are sick, and quarantine refers to people who may have come in contact with COVID but haven't tested positive or gotten sick. So if someone tests positive for COVID, they need to isolate at home for a good 10 days so they're not spreading it to others. And then within the home, all their family members need to stay far away from them. So if you have a house where you have one person who's sick and that sick person can stay in the basement, if it's a high school student, stay in their room, they don't mind that, and then bring food up to them and leave it at the door. That's great. If you can't do that, it's important that you let us know at the health department, because we do have a lot of folks that are living in apartments. And if one person's sick, there really isn't a way for them to avoid others. They share the bathroom, they share a kitchen. And so in those cases, there are resources that the county can help with. And in rare circumstances, we can even take that person who's sick and put them in a hotel so that they're not exposing their family members.
Going
Okay.
back, going back to the vaccine, do you believe that we will really be able to get like 90% of the population vaccinated here? Like, is that possible?
Well, we hope so. The more folks that get vaccinated, the quicker this will go away as a problem for us. It's same thing with flu vaccination. So hopefully you all got your flu shots this year. We're hoping more folks get vaccinated this year than typically do, because there's always there's always a group of folks that don't get vaccinated, particularly teenagers and those in their 20s who feel, well, if I get the flu, it's not going to cause a problem because I'm young, I'm healthy. But this year, if you get the flu, you may not be able to get into an emergency department for care if you need it because they're filled up with COVID patients. Or you're going to be, if Broad Run, for example, goes back to hybrid, if you have the flu, they're not going to let you back in because they can't tell us if it's the flu or COVID. So we want you all to stay healthy. And that's going to be important. And so similarly, we want everyone, when it comes around, to get vaccinated. The good part for the large majority of Loudoun County residents, by the time the vaccine gets to you, so many other folks will have taken it, will have shown that it's a safe and effective vaccine, that these initial concerns about whether there may be side effects from it or not will start going away. But the critical piece is for those who want to get back to normal, and we're all sick of this, that if we want to get back to normal, then right now when there's no vaccine, wear your mask, keep your distance, don't go to parties, and then when there is vaccine, get vaccinated. That's how we'll start getting back to normal.
You said that like in Loudoun County it will be easier since we'll see the side effects, so since we'll get it later. Like, what do you mean by that? Are you talking about like the CDC? Oh, sorry.
So there's a prioritization process throughout the whole country, not just Loudoun. But as the vaccine comes out, it's not all going to come out at once. We're not going to have doses for 300 million people as soon as it gets approved. And particularly since this is a vaccine that is likely going to need a second dose. So you essentially need 600 million doses of vaccine. So as soon as it comes out, they're going to be distributing it. What the CDC is coming up with now is a list of who should get vaccine first. And typically, those are people in the healthcare industry, because if we don't have doctors and nurses and other healthcare providers in our hospitals taking care of people with COVID, then unfortunately more people are going to die. So it's important that healthcare providers get vaccinated. It's important that those who are at very high risk of having significant consequences if they get infected get vaccinated, because we want to cut down on hospitalizations and deaths. So by the time it gets to you, so many other people in the community will have gotten vaccinated. You will have seen they've gotten vaccinated and known that, yeah, you may get a reaction to it. You've gotten shots. Sometimes you get muscle aches when you get a shot. Sometimes people might get a bit of a fever when they get a shot. That happens. You're not infectious, and you get over it.
Okay. So going back to the public and private facilities, right? So how will they be required to operate post-corona? Will they still have to wear masks after the vaccine is out? And will we still have to social distance for a long time after the vaccine is out?
Well, that's going to be up to the governor, because right now it's the state that is making these requirements. And so what the governor has done throughout this whole process is, when it looked like this was getting out of hand in April, May, June, he said, look, everyone stays home. And then he slowly reopened. And now recently he's slowly tightening because the numbers are going up. So he looks at this information very closely. He is a physician as well, but working with his agencies saying, well, when can we open up more? When can we open up all the way? And while it's hard to predict, what will likely happen is, as soon as we get to a point where there's not ongoing transmission in the community, that's when you start thinking about, oh, well, maybe now we don't need to wear masks. Maybe now we can go back to movie theaters, eat regularly at restaurants, go to parties again.
So, there's been a lot floating around about herd immunity. What exactly do you think of herd immunity for COVID-19? Like, can we achieve it? And what will it take to achieve it, if possible?
Yeah, you achieve herd immunity through vaccination. What herd immunity means is that even if everybody doesn't get sick or get vaccinated, then you're probably, those folks who are still susceptible to the virus probably won't get infected because everyone else around them is covered. So it's one of the things, like, for example, where for pertussis, when you're really young, you can't give the babies those shots. So it's important that all of us get those shots so babies don't get infected and get hospitalized. Or same thing with measles, that for the first 15 months of life, it's too early to get a measles shot. So we don't want any measles floating around because infants can get it. And that's one of the reasons it's important for all of us to get vaccinated. But it's the vaccine that's going to do it. The percentage of folks that have to be immune to get herd immunity varies depending on how infectious a virus is. But this is a pretty infectious virus we're seeing. So it may be around 70% of everyone in the county has to be immune. We know we're never going to get to that number by the people who are infected. The only way you get to that is through vaccine.
So, you just said that there's no way to get it unless you have the vaccine, right?
No way to get herd immunity.
Yeah.
Yeah, right. Because we're not going to have 70% of our county get infected with COVID. That would result in so many of our senior citizens getting hospitalized or dying. Really, what we're trying our best to do is protect them from getting infected by protecting us from getting infected. Because the challenge is, if you get infected with COVID, odds are you're not going to get hospitalized and die. You might. Some teenagers have died. More teenagers have gotten hospitalized, but the odds are against it. But if you go to Giant to pick up some groceries, easily there's a senior citizen walking down the aisle or adjacent from you that you can pass the virus on to. Or you pass it on to someone in their 30s who happens to work in a nursing home, and they infect a senior citizen. And that's why all of us need to stay protected.
Absolutely. I go 100% agree. So we can go back to could we go back to the vaccine now? Because I think that seems to be like a hot button issue right now. So I think there's 4 vaccines. That's what Miss Randall told us. Pfizer, Moderna, and Johnson & Johnson, and I can't remember the other one. So which ones are looking the most promising for Loudoun County to buy? Will there be like a cost associated with it for people to get it? And
there's no cost. There's no cost to anyone for vaccine. Everyone will get the vaccine for free, whether you have insurance or not. So what really the driver will be is when we'll be getting vaccine as it comes out. So in all likelihood, the first vaccine that we'll see in Virginia and Loudoun County is from Pfizer, because that's the first one that looks like it's going to get approval from the FDA. It's not any better or worse than the others. It's just different. And then likely the second one will be Moderna. Again, not because it's better or worse. They're all going to be safe and effective, or else they're not going to be allowed to be administered to folks. So what I recommend is, when we have vaccine available, and you're in the group that can get the vaccine, get the vaccine. Don't wait for a different product, because we don't know when that other product's going to be coming. And what the last thing we would want is for someone to put off getting vaccinated when they have a chance to. They get sick, pass it on to someone else, or they themselves get hospitalized as a result.
Okay, so has anyone really seen the effects of taking more than one of these types of vaccines? And is Loudoun County looking to buy more than one type?
So we don't have to buy any of it. It's all coming from the federal government to Virginia at no cost. Virginia is then distributing it to all the jurisdictions, all the counties and cities within the Commonwealth. So we don't have to pay anything for the vaccine, for the needles, for the cotton balls. All that stuff is coming free to us. And so essentially what we're getting is, as soon as the manufacturer has vaccine available to provide to the United States, they're shipping it out to every state in the country. And then the state government, so ours would come to Richmond, will be shipping it up to Loudoun County as soon as they can.
Okay, so which ones are we looking to buy though? Like,
we're not buying any. So we're going to get
okay, which ones are we looking to have?
So at a minimum, there are 3 different products that should be coming to Virginia within the next month, because those are the ones that are further along. We may, at the end of the day, have 6 different products available, and it doesn't matter to the person getting them which one they get. The only thing that's important is, if you need to take a booster shot, you get it from the same company. So if you got Pfizer for your first dose, you need to get Pfizer for your second dose. And that's going to be part of the process we work through to make sure folks know which product they received and when they're eligible to get their booster dose.
So staying on the topic of vaccination, how exactly are we going to get this to everybody? Like, are we going to go door to door, or are we going to, have like centers across where people can come and get vaccinated?
So a lot that will drive it will be how much vaccine we have on hand. We expect in the early days to not have a lot of vaccine at all. So those likely will be in a set facility that are set up for specific hospitals, because healthcare workers are a top priority. So it may be, one day we're going to do hospital workers, another day we're going to do EMS personnel, another day might be pharmacists and private doctors' offices. And those probably are not going to be very visible at all to the public. As we get past all those priority groups that we need to make sure get hit right away and are open to the general public, that's when you'll start hearing about sites that are open where anyone could go in and get vaccine. A key part of it, though, is what we know from our history doing vaccination efforts and working with the different communities are, some folks get information right away. They've signed up for the county's alert system. They watch the news all the time. They're listening for where they could go to get vaccine, and they could drive to wherever it is. We have other folks that don't. 1 out of every 4 people in our county was born in another country. So we have a lot of folks that have language issues, they have cultural differences, they may have transportation barriers. So in addition to making sure we set up vaccination locations throughout the county, we need to do focused outreach to these groups, or we call our hard to reach populations, because they're hard to reach to get the word out. We need to make sure everyone has the same type of access to vaccine once it's open to the general public.
Our platform can really help with that, because we have like a diverse, I guess, base, like watcher stuff, and we're definitely going to put this out too.
Yeah. And that's what, at least in Loudoun County, why our school system is so important for getting the word out, because a lot of our immigrant population have kids in the school system, and it may be that their children are the ones that bring the word home to the parents. It may be that the only alerts that the parents get are the alerts from the school, through Parent View or through other means from the school system. So we partner very closely with our schools. Additionally, particularly our elementary schools, they tend to be right in the communities. So if, for example, we said, well, we need to make sure in Sterling that folks know about this. Well, we've got Sterling Elementary School, we've got Parkview, Yeah, we've got lots of schools that we can utilize to be right in that area where folks live.
That's actually a very like smart way to communicate. I didn't think about that. And I think like honestly, like the federal government could probably do something similar to help with their communication as well. I didn't
Yeah.
think about
Now we understand that not everyone has kids
Yeah.
in the school system. And Loudoun disproportionately folks do, which is helpful. And in addition to that, we've been working since the start of coronavirus with our human service nonprofit agencies that have as their mission working with these harder to reach populations to get the word out. Because as I talked about, different people have different cultural beliefs. And particularly for some of our immigrants of color and our persons of color, they may have a distrust of government, they may have a distrust of vaccines. And so it's important to start working with them to see, what are their concerns, what are their barriers to getting vaccinated, so that we can work with them to keep them as safe as the rest of the community.
That's very insightful. So moving on to like another question. This is regarding Thanksgiving, shifting gears from the vaccine. So how do you think the rest, like the recent surge, the expected recent surge of COVID will pan out? Because I saw like some statistics that are saying that they were going to see the like surge from Thanksgiving like in 2 weeks. So like, how is that going to work?
Yeah, so we did see cases go up right around Thanksgiving because a lot more people got tested than normally get tested. A lot of people were concerned about having friends over or going to visit friends if they might have been infected. And that helped elevate our number of cases because we know that so many folks could be infectious with COVID and have no symptoms at all. So the more folks that get tested, the better. It also lowered our percent positivity of cases. So while lower risk folks were getting tested, the percentage of tests that came back positive got reduced. So if you're only testing really sick people, you'll have a high percentage, but you'll have fewer total cases. In this situation, we had a whole bunch of folks get tested, which led to an increase in our caseload, but dropped our percent positive rate a bit. That's coming back up again, the percent positive numbers. What next week will probably be a good sense of how many people got infected around Thanksgiving, because it takes 5 to 7 days on average for someone to start feeling sick once they've been infected. And it may take them another day or two to get a test done, and it may take the test 4 days or so to turn around. So there could be a good 10 days to 2 weeks between when someone gets infected with the virus and when they show up as a positive test. And that's what we've seen before with Halloween, when we saw our Halloween cases show up. And that's what we'll be looking for next week with Thanksgiving cases.
So as you said, you talked about asymptomatic carriers, right? People that might have the virus, but they don't know and they don't show any symptoms, right? So how many cases do you think there are actually in Loudoun County?
We don't know. Originally, back in the spring, the view was that for every one case we knew of, there might be 10 that we don't know of. We don't know what that number is now, because it's just hard to know. But we know, as I said, that every time we hold one of our large events, which is mainly used by people who have no symptoms, because if you have any symptoms at all, you'll probably go to the doctor and you can get a test at no cost. But for folks who have no symptoms, no risk factors, it may be harder to go to get a test. And many folks may say, well, why bother? I'm feeling fine. But when we hold these large scale events, which may get 1,500 or 2,000 people coming in, we may out of that get another 150 positive results. And to a large extent, these are folks that didn't know they were infected and easily would never have gotten tested if it wasn't there. So we know that those folks are out there. And that's one of the most insidious things about this virus. If you knew when you had COVID, we'd have so many fewer cases. But when people feel well all the time, it's just hard to to give up the things that are important to folks, particularly as we're going into the 9th month of this. To go, well, do I still have to keep 6-foot distancing? Can I still not go into a restaurant and risk exposing other people? I feel perfectly fine, but that may be the one day that you actually are infectious.
Oh, so that's really cool to think about. So moving on to going back to the vaccine. Will people have to take it? Is there plans to mandate this vaccine in schools or government?
No, there's no plans at this point to mandate vaccination. What's unknown is whether at some point it might be part of the required vaccination for students, because there's a list of vaccines that all students have to take. So there may be at some point in the future a state requirement for getting vaccinated for COVID, just like you're required to get vaccinated for measles and other infections. But I don't think anyone's planning that as of now, and definitely not for the rest of the population.
For the vaccine mandates, do you think that that's not going to happen because of political reasons, or is there some scientific reason behind it?
Well, I think the real question is, can you get enough people who choose to get vaccinated? And if you do, then you usually don't need a requirement for vaccination. And so I think that'll be the test of what happened. My sense in Loudoun County, we're going to get a large proportion of our population take advantage of the vaccine, assuming that it's as safe and as effective as all the data shows so far.
So as you said earlier in this interview, you said that herd immunity is only available first of all, if a mass amount of people die, or if a large population has the what's it called, the shot, right? Is that true?
Well, they don't need to die. They either have to get infected or get vaccinated. But one way or another, you have to have a certain percentage of folks that are immune, meaning that if someone coughs the virus on you, it's not going to do anything. You already have antibodies to it.
Yeah.
And that's what herd immunity is.
So with that, right, you said that there's probably going to be no mandate except for some school students, correct? Is that what you said?
Yeah, so it would be up to the governor to make that determination. But my gut sense is for the general public, there's not going to be any requirement for vaccination. It's just a really good idea. If we want to get back to normal, that's what we should be doing.
So how do we get herd immunity if
because
not
we
everybody's forced to get
expect
it?
that people will get vaccinated. So, for example, there's no requirement that you get that an adult get a tetanus booster every 10 years. But people realize, hey, I don't want to get tetanus. That's not a good thing. So I'll get a tetanus booster shot. And for the same reason, same thing with the flu vaccine. That a large proportion of our population gets a flu vaccine every year. It's not mandated, but it's a good thing to do.
That about concludes everything. Thank you so much for coming here and for agreeing to be in this interview. We really appreciate everything you're doing for Loudoun. So thank you.
Sure, and thank you for spreading the word.